now we are getting in the main part of our course, meaning we're getting in the practical part of our course of orthodontic solutions. We are going to see now the first order bands, loops, elastics, torques, anything that you need, everything that you need in order to get the best results in orthodontics, the best results in refinement of orthodontic cases, okay? So the first of those bands that we are going to address is the first order bands. First order bands because they are the easiest bands that we can use in orthodontics. They are easy to do, they are easy to think, so it's good to begin with them, okay? So let's see how we do these bands, let's see how we're going to use them. We don't use that much the first order bands because we have other options that we can put in our armamentarium in order to have the same result using less force, using less amount of force. So this is important for us, especially in the lower arch. When you do bands in the lower arch, we don't have an interbracted distance so big or big enough in order to apply a low level of force. So this is something that we have to take into account when we are going to choose which kind of device, which kind of band or loops we are going to apply in that situation. So with that in mind, if you want to do a band, a first order band, just think, can I replace this first order band for example, a loop, a simple loop, a double loop, or something like that? If you can do this, it's better for you, it's better for your patient, it's better for the treatment. Since you have less force and you can do just like a more physiological, do that in a more physiological way. I'm going to show you cases where I use this band, but I have to say that these bands are not my preference, but I do them in some situations where you can solve some cases, solve some problems. So first order bands, all the bands that you do in the horizontal way, meaning when you look from above your model or your dental arch. So you're going to do the bands in a horizontal way. They are called first order bands. So when we do this, for example, a Z band in order to correct a rotation, or a inset band in order to correct or to adapt a different thickness of teeth. So you can do this, you can use this kind of band here or this kind of band here. So first order bands are those made horizontally in the arch wire. So we do the bands just looking from above. If you put your band, if you put your arch wire seated on a glass slab, you see that you go out of the contour of the arch wire just in that place. This is important. So these are the first order bands: insets, offsets, canine eminence bands, which is like something like a shoulder, like a shoulder. When you do this kind of band, a curve, for example, we call them eminence, canine eminence. You do that obviously in canines. Toe in, toe out, first order Z band. So we have some options of bands to use to solve problems or to adapt to some situations, to some special situations. This is what we are going to do now. Inset band. So it's very common if you did edgewise for a while, if you are, or this time you did with some patients, you used an edgewise appliance, not programmed appliance, for example, an edgewise, a regular edgewise, standard edgewise. You had to do this kind of band because the bracket, it doesn't adapt, it doesn't compensate the thickness of the lateral incisor, which is thinner than the central incisor and the canine, their neighboring teeth. So when you do this in an edgewise appliance, you don't want to put your lateral incisor in the arch wire. You don't want to go towards palatal with the lateral incisor. Usually you want to adapt the difference between the thickness of the lateral incisor, the central incisor, and the canine, which is something like 1 millimeter of difference in thickness from the contact point to the most buccal site of the lateral incisor, comparing obviously to the central and the canine. So this is something that we usually do in edgewise appliance. But you have some situations, for example, when you have a peg-shaped lateral incisor, you have to adapt that also because you don't have the thickness. Even if you are using a pre-programmed bracket, a pre-programmed straight wire appliance, sometimes those thickness embedded in the bracket, they are not enough. Let's say they are not sufficient for doing this kind of compensation. So you have to do a little bit more, and for that you can use this kind of band, a first order band, because if you have a thinner lateral incisor compared to the neighboring teeth, you are going to have this lateral incisor more buccal. Its tip is going to be more buccal because it goes like a little bit forward because of the thinner shape of this lateral incisor, which comes with the comparing to the central and canine. It brings them, those lateral incisor, a little bit forward, but just inclining them. So sometimes you have to do this kind of bend in order to compensate or in order to correct, if you didn't do that before, in order to correct that difference between lateral incisors, central and canine. So you do this kind of bend to align the tips, to align the tip of the lateral incisor, the central incisor, and the canine cusp. So for that, one option that we have is using this kind of band, is making a first order band to go towards palatal with the lateral incisors tip. So this is what we do, and this is what we expect to happen when we do this kind of band in order to correct this difference between the lateral incisor, the canine, and the central incisor. So this is not always that you have to do, because your pre-programmed brackets, your pre-programmed straight wire appliance, it has compensated inside its base, the thickness that you don't have in the lateral incisor. So sometimes you have to do that because you don't have the exact amount of the thickness of the base in the lateral incisor bracket. Sometimes you do that to compensate. So first order bands. What's important in a band like this? As you're going to see when you show you how to do step by step those bands, the practical part of our course with exercises, you are going to do this band, but you can't get out of the contour of the arch wire. If you do that, you're producing another kind of band. So you have to do the band, the inset, you go inwards, you go towards palatal. So you do that and you go back to the contour of the arch wire without angulation in this part of the band. So this part of the band is parallel to the anterior segment of the arch wire. So it just goes inside here and here. Then it goes back to the natural, to the contour of the arch wire. This is important for us. So how do we do this? How do I show my students how to do that? So for me, I start as a reference the medial part of the arch wire. So thinking always doing the first bend medially to the plier, thinking about the arch wire, the center of the arch wire, the center of the midline. So you start from there, and goes to the end of the arch wire, doing this bend this way, starting medial to the midline. So you do this kind of bend. First, you pressure your toe. For example, I use my toe for that. You can pressure your toe against the arch wire, grabbing firmly the plier here. Don't let the plier, don't let the wire rotate with the plier, you have to grab it firmly. So grab it here, you have to mark, you have to do the marks, of course. You're going to see step by step in the practical part of our course. So this is what we do. We grab the arch wire here and we go inwards here. We go inwards towards palatal, okay? So pressure is applied here from the thumb to the wire towards palatal, okay? So this is what I do. The first is the in band. Then you go without removing the plier. You go now you go up, out. You go buccally. You go towards buccal. Put your finger, your index finger, for example, here. Then you put this pressure and the opposite direction that you put the first pressure. What you can do in order to facilitate that for you is to give a little rotation of your wrist. Your wrist goes like this in order to help you to do the band. So this is something that I do, and once you get used to that, you're going to do that naturally. So you go with the pressure and you go with the wrist rotating, okay, like this. Pressure here and rotation in the opposite direction. It helps you. So here we're going to show how to do, but when you go to the practical part with the exercises, you are going to understand it better because it goes with videos and you see the video and you try to replicate that and it's easier for you to understand. But this is how I do. First in, then out. Keeping the plier on the same point. The second movement is done with the index finger distal to the plier on an anterior direction, meaning you go outwards now. So you first went inwards, now you go outwards. So first mesial, you have here the midline, the mark of the midline, then you mark the position of the lateral incisor, the mesial of the lateral incisor. So first you go inwards, then you go outwards, in and out. This is how I explain because it's easier for you to understand how this go in and out, because it differs if you use different relations, if you use different point of views. So I first go like the mesial part is my first band, then we go the distal part of the arch wire, the second band, without removing the plier of its position. So this is how I do. So first one, then you go out. First in, then you go out. This is how we do. As you can see, mesial, in, and you go distal out. Mesial, in, and distal out. Let's see it again. So you grab with your plier the arch wire, then you go mesial to the plier, in, and distal to the plier, out, without removing the plier of its position. This is how we do. At this point, you may be thinking, but we have pliers that are specifically used for this kind of bend. Yes, there are, but they don't have all the magnitude of the bends that you need to do. And sometimes you want to do a different bend, like an asymmetric bend. Here you go this way, you go with more angulation, less angulation of the active part of the band. So this is important. How do we do this? We do like that because I think it's more controllable. We can do we can control this band this way. We go in and we go out. We can do a little bit more or a little bit less of angulation when you do the band, so it will produce different bands. A lighter band or a heavier band. So this is something that we can do using the angulation of the first pressure that you're using. You can do a little bit more or a little bit less marked bend. This is something that you can use, and you will see during the course of your day-to-day practice that this is something that is very natural. You don't need many pliers for that. You don't need to choose the plier to search for your plier. You have this very beautiful plier, the 139 plier, or bird beak as you can call in other countries, or a jarabac. This is the same plier. So this is something that you can do with other pliers. Yes, we can. But this is something that I do with this same plier for most of the bends that I use in my practice. Keeping that in mind, we're going to the other band. Now it's the opposite. We're going back. Now we're going back to the contour of the arch wire. So we go exactly the opposite that we did first. Now we go first outwards, then we go inwards, okay? So this is the second band. We go outwards, then we go inwards. This is the second band for this inset band. As you can see, it's quite the opposite that comparing to what you did before. So we go first out, then you go in. First you go out, then we go in. Let's see it again, just one more time. You go out, putting your finger in the middle, you go in, putting your finger in the distal to the plier. So this is the reference that I use in order to try to teach my students how to do. First you go out in this band, then you go in. Let's see it again, just one more time in order to facilitate the comprehension. So we go the first band, medial, so we go first inwards, then you go outwards. Again, inwards and outwards. So the first band is this, go inwards, then you go outwards. This is something that it's quite natural when you do it a lot. So you have to practice in order to understand that. This is the first band of an inset band. In and out without removing the plier of its position. Then you go, now you go in the second part, meaning the distal band related to the lateral incisor, go out, then you go in. So you go, first you go out, grab the wire with the plier, medial out, distal in. Again, let's see just one more time. We go up, now we go medial out and distal in. As you can see here, I'm using both my finger pressure and my wrist rotating. So I'm going both here. Rotating wrist and the pressure and my fingers, okay? This is the inset band. How can we be certain that this band is quite what I wanted to do? We can go in our, put this kind of band in a white paper or in your glass slab. In your white paper, it's better to see the first bands that you do, and you try to see if you are using the band the right way, meaning you don't have an angulation here. Any angulation is produced here. We have the contour of the arch wire maintained. If you just think like a thin mark here, you're going to see that we have the continuing of the arch wire. In this part, you have the same contour here, and you just have this little part, which is the part that is active in the band, that is inwards, okay? So it's necessary to preserve the original contour of the arch wire. So this is something that is easy to understand since you do it a lot, okay? This is the first order band, the inset band. Okay, guys? So see you later. Very good. Let's go. Let's move on.